Age-related macular degeneration, or AMD, is the leading cause of vision loss in adults. It changes everything in a person's life. Reading, driving, cooking. AMD robs people of their central vision. It causes changes to the eye's macula, which sits in the center of the retina at the back of your eye. The retina receives visual information and relays it to the brain, and even though the macula is only 2% of the retina, it processes 50% of visual information. AMD comes in two types, dry and wet. In wet AMD, abnormal and fragile blood vessels grow under the macula, causing blood to leak and destroy your photoreceptors. A growth factor called VEGF causes the abnormal blood vessels, so currently doctors treat patients with an anti-VEGF protein injected into the back of their eye, usually every couple months. A still experimental gene therapy is proving effective in letting patients stop the injections or reduce their frequency 80 to 90%. That therapy turns a patient's own cells into drug factories making and releasing a proven anti-VEGF protein, aflibercept. To get the gene that codes for that protein into cells, the therapy uses a virus that does not cause disease, but is very good at carrying things into human cells. Many copies of what are called adeno-associated virus vectors are loaded with their genetic cargo and injected into the eye. There, they can insert the gene into cells that can produce the protein coded in the gene. Once the patient's cells have made and released the protein, it acts like a decoy for VEGF. It binds to the VEGF that would have instructed the cells to make new blood vessels. VEGF is blocked from doing its harm. Patients had slight improvements in vision that remained stable, in a disease that is usually constantly making vision worse, robbing patients of more and more of their visual field. The first phase of this clinical trial has shown the therapy remained effective for 2 years. A second phase of the trial started treating patients in November 2022.